an obstetrician gynaecologist based here in Geraldton. We have this fabulous team of about 10 GP obstetricians, plus we have 2 privately practicing midwives, and obviously then also our hospital midwives as well. There's 2 other consultants as part of the team. We have a training registrar and then also the resident. So we have our registrar, so that's someone who's usually in their first or second year that is rotated to us from King Edward Hospital, and they're on the specialist training program. We're also trying to increase our capacity to train for the junior doctors who are looking at doing what is now called the Associate Obstetric program, which used to be called the DRANSCOG. Most people, they're probably in about their second or third year would look at doing it. So it takes a minimum of 6 months to do with us. And I guess one of the reasons we think it's so good here is because we are a smaller unit, and so they get much more involved with the other GPs, so they're working much more independently than what they would if they were down in Metro. We do recognise that we don't have the sort of high risk cases and the busyness of what we have in Metro. So we have set up a program where people can take a week off from here, go down to King Edward and spend a week down there. And basically they claim their professional development leave from us. Rural Health West pays for their accommodation and their transport to get down there, just to give them, make sure that they get that exposure of some high acuity cases. We've generally in the past been accredited for people who have done most of their training in Metro and just need exposure to a couple of more procedures or cases with that sort of thing, but we can do it from scratch. We really only want to do it for 1 resident a year, so we block off 6 months for that resident. We want to keep the other 6 months free for those other residents who just want to get a taster. So it's about growing our own, and very much because they're part of our team with the GPs, they're learning from those GP obstetricians that they are then going to go on and join that team. So the GP obstetricians who are part of our team are also very invested in teaching the resident. There is also always the support, that everyone is always around by phone call, and we understand that people are junior. We see our residents more as people, I think, rather than as a number. You're not competing with other people, so you're more likely to get your births there, that you're more likely to get your hands on for instruments. Because you're there for a 6-month rotation, it's very likely that the women you're looking after in labour ward you have met for some other reason during their antenatal care. And I think that's the real joy of obstetrics, so it's getting them to see that without the time pressure of churning through numbers. I would say go for it, because these opportunities aren't that common. There's a real misconception that you have to go to the city to get this training. So I think it really is about opening your eyes. 6 months is a very, very short time for it. But you actually do have a couple of years to finish the training. So even if we get the bulk of the training done in that 6 months, if you're still in the community working as a GP, we can still finish off the official qualifications as well. So again, that would be another advantage for actually doing it somewhere in a country place where you then know you're going to go and work on as a GP.